HIT6 is a pretty widely used measure of migraine impact. So when we do preventive treatment trials or when we treat migraine in practice, one issue is what happens to headache day frequency. Does the number of monthly migraine days go down? But another issue is, does the impact of migraine on a person's life go down? HIT6 is a 6-item questionnaire that measures the overall impact of migraine over a 4-week recall period. So in the Eptinezumab clinical trials, people completed the HIT6 questionnaire at baseline and then monthly thereafter. And the purpose of this analysis was to examine the trajectory of reduction in headache impact on active drug versus placebo. The way we analyzed the data from the clinical trial is we looked at what headache impact was at baseline, and then we examined how headache impact improved over time. And what we saw was that first, over the first month, there was a rapid and clinically meaningful reduction in the impact of headache in people who got active medication. And we also showed that after a month, those benefits were sustained throughout the treatment period, and that the magnitude of the treatment effect passed the threshold of clinically meaningful change. I think the findings of the study are really good news both for patients and for physicians, because it says that over the course of a month, the impact of migraine on patients' lives, as measured by HIT6, reduces very steeply and then stays reduced throughout the rest of the treatment period. Because HIT6 has a 4-week recall interval, we looked at baseline and we looked 4 weeks later, so we didn't actually look during the first 4-week interval, but the curves show a rapid decline and then stable maintenance of the reduced impact with HIT6, and that is exactly the finding I was hoping to see.